1 out of every 4 American adults living with diabetes has no idea they have the condition. The good news is that catching it early allows us prevent all the issues we're about to discuss. What is diabetes? Diabetes is a chronic condition in which your body either does not produce enough insulin or cannot effectively use the insulin it produces. Insulin is the hormone responsible for moving glucose from your bloodstream into your cells for energy. When this system fails, glucose builds up in your blood. Over time, high blood sugar damages your blood vessels, nerves, and organs. The early signs often appear first in places you can see or feel: your skin, your eyes, your hands, your feet, and your bladder. Polyuria. Polyuria is the medical term for excessive urination. One of the earliest signs of diabetes is waking up multiple times during the night to use the bathroom. You used to sleep through the night, but now you find yourself getting up at 1 a.m., then again at 3 a.m., then again at 5 a.m. During the day, your bathroom breaks become noticeably more frequent. This happens because your kidneys cannot reabsorb all the excess glucose in your blood. The glucose spills into your urine and it pulls water with it. The result is large volumes of urine in a bladder that never stays empty for long. Acanthosis nigricans. Acanthosis nigricans appears as dark, thickened patches of skin that feel velvety to the touch. You will most commonly find these patches on the back of your neck, in your armpits, under your breasts, and in your groin. The skin looks dirty, but it does not wash off. Scrubbing makes no difference. This condition is caused by high levels of insulin in your bloodstream. Excess insulin spills into your skin and triggers the rapid growth of skin cells and extra melanin. Acanthosis nigricans is one of the most visible markers of insulin resistance and is often seen years before a formal diabetes diagnosis. Skin tags. Skin tags are small, soft, flesh-colored growths that hang off your skin by a thin stalk. They are harmless on their own, but a sudden increase in the number of skin tags, particularly on your neck, armpits, and eyelids, is associated with insulin resistance. High insulin levels promote the growth of these benign tumors. If you develop multiple skin tags in a short period, especially alongside acanthosis nigricans, you should consider being tested for prediabetes or type 2 diabetes. Infections. High blood sugar weakens your immune system, making infections more common and harder to treat. Several types of infections are visible signs of undiagnosed diabetes. Skin infections such as boils, carbuncles, and styes appear repeatedly. A boil on your thigh clears up with antibiotics, only to return a few weeks later on your armpit. Fungal infections are also common. You may notice athlete's foot, jock itch, ringworm, or vaginal yeast infections occurring frequently because yeast and fungi feed on sugar. If you have 4 yeast infections in a single year, you should be tested for diabetes. Gum infections are another visible sign. Your gums become red, swollen, and bleed easily when you brush. Over time, your gums pull away from your teeth, making your teeth look longer. Diabetic stiff hand syndrome. Diabetic stiff hand syndrome, also known as diabetic chiroarthropathy, causes your hands to become stiff and waxy. You may notice that you cannot press your palms flat together in a praying position. There may be a gap between your palms when you press your fingers together. The skin on the backs of your hands becomes thick, tight, and shiny, almost like wax paper. This happens because high blood sugar causes collagen in your skin and tendons to become cross-linked and less flexible. The condition is painless but progressive. Over time, you may struggle to pick up small objects, button a shirt, or make a fist. Frozen shoulder. Frozen shoulder, or adhesive capsulitis, is a condition in which your shoulder joint becomes stiff and painful. You lose range of motion gradually. You may not be able to lift your arm above your shoulder, reach behind your back, or sleep on that side. Frozen shoulder is significantly more common in people with diabetes than in the general population. In non-diabetics, about 2 to 5% of people develop frozen shoulder. In diabetics, the rate jumps to 10 to 20%. The condition can last for 1 to 3 years and often affects both shoulders at different times. The cause is not fully understood, but high blood sugar leads to the accumulation of advanced glycation end products in your shoulder capsule, making the tissue thick and inelastic.
Neuropathy.
Diabetic neuropathy is nerve damage caused by prolonged high blood sugar. The most common form affects your feet and hands in a stocking and glove distribution. You may first notice tingling, pins and needles, or a feeling of walking on cotton. Over time, numbness sets in. You cannot feel a light touch on your toes or fingertips. You may not notice a pebble inside your shoe or a blister forming from a new pair of socks. This loss of sensation is dangerous because minor injuries go unnoticed and can become infected. Some people experience burning pain, electric shocks, or extreme sensitivity to touch. Even the weight of a bed sheet can be unbearable. Neuropathy is not reversible, but early blood sugar control can slow its progression. Charcot foot. Charcot foot is a severe complication of diabetic neuropathy. The bones in your foot become weak and fracture, but you do not feel the pain of the fracture because your nerves are already damaged. You continue to walk on the broken bones, which collapse and shift. Your foot begins to change shape visibly. Your arch may collapse, making your foot look flat and wide. The bottom of your foot may develop a rocker bottom curve. Your foot becomes red, warm, and swollen. One foot may look noticeably larger and more deformed than the other. Charcot foot is often mistaken for an infection or gout because of the redness and swelling, but an X-ray reveals the shattered bone structure. Without treatment, your foot becomes permanently deformed, leading to pressure sores, ulcers, and potentially amputation. Diabetic foot infection. A diabetic foot infection often begins with something small. You step on a tack and do not feel it. A blister forms from a poorly fitting shoe. A callus cracks open. Because of neuropathy, you do not notice the injury. Because of poor circulation, the wound does not heal. Bacteria enter and infection sets in. Your foot becomes red, swollen, warm to the touch, and possibly foul smelling. Pus may drain from the wound. In severe cases, the infection spreads to the bone, a condition called osteomyelitis. A black or purple area on your foot indicates gangrene, which is tissue death. This is a medical emergency. Diabetic foot infections are the leading cause of non-traumatic lower limb amputations worldwide. Gastroparesis. Gastroparesis, sometimes called delayed gastric emptying, is a condition in which your stomach takes too long to empty its contents into your small intestine. High blood sugar damages the vagus nerve, which controls your digestive tract. You may feel full after eating only a few bites of food. Nausea and vomiting are common, especially several hours after a meal. Bloating and abdominal pain are also visible signs. Your belly may look distended. Your blood sugar becomes harder to manage because food enters your bloodstream unpredictably, sometimes too quickly, sometimes too slowly. Weight loss is common because you cannot eat normally. Gastroparesis is not curable, but blood sugar control and dietary changes can reduce your symptoms.